You are called to a local high school for a possible hemorrhage. Upon arrival, you're escorted by the principal to a girls' restroom where you find a teacher sitting on the floor holding a crying 14-year-old girl while a second teacher holds a bloody towel over a wound of the girl's left wrist. A broken piece of glass is lying on the floor covered with blood. You observe approximately 300 milliliters of bright red blood on the floor. The teacher holding pressure informs you that the girl was found about 10 minutes prior to your arrival by a classmate. There's an approximate 3-inch laceration over the girl's left wrist.
Okay. So I'm wearing proper PPE. Is my scene safe?
Yes.
Okay. Mechanism of injury, she cut herself with a piece of glass, 3-inch laceration, losing 300 milliliters of blood. One patient, I would consider ALS just to stay on the safe side. And my general impression is I have a young girl sitting on the floor, bleeding, and obviously upset. Chief complaint.
A 3-inch laceration to left wrist.
Okay. So moving on to ABC's airway. She's crying. I mean, I assume it's patent.
Yes.
Okay. Breathing. What's her respiration rate?
16 beats per minute, irregular, crying.
Okay. Probably irregular because she is crying. What is SpO2?
98% on room air.
Okay. And what is what's the blood pressure?
114/72.
Okay. And so I would say she's not going into shock. She does not need shock management. She does not need an OPA, NPA because her airway's patent, by the way. Forgot to say that. Is there any other bleeding anywhere else?
None.
Okay. I can't remember if I did C-spine, but if I did not do C-spine, I would go ahead and do it because we don't know if she hit her head before she was found. Circulation, what is the pulse?
104 beats per minute, rapid and strong.
Okay. And what is skin color?
Warm, pink, and dry.
Okay. And does it say cap refill? I assume that face means no. Okay. So, patient priority, I would say, is rapid transport. I would do the rest in the ambulance. So, baseline vitals, we have blood pressure 114/72, pulse 104. What are her pupils?
Pearl.
Okay. And what about the respiration is 16. I forgot to auscultate lung sounds. What are those? That would be up in B, breathing.
Normal rate and volume.
Okay.
Adequate symmetrical rise and fall of chest.
Okay. And then equal chest rise and fall still?
Yes.
Okay. So moving on to sample history, signs and symptoms. Signs and symptoms is that she cut herself, lost 300 milliliters of blood. Is there any allergies?
It does not say.
Medications?
Prozac for depression.
Okay. Pertinent medical history.
It does not say.
Okay. And last oral intake.
Lunch approximately 1 hour ago.
Events leading up to.
Breakup with boyfriend at lunch.
All right. So moving on to the secondary assessment. If I palpate the head, do I find anything?
No injuries noted.
Okay. If I check the ears, nose, mouth, eyes, is there any CSF bleeding, anything like that?
No.
Okay. Pupils are still pearl.
Yes.
Okay. So then neck, is there any JVD present?
No JVD.
And is the trachea midline?
It's tracheal shift or no
Yeah,
tracheal shift.
No tracheal shift. Okay. And then what about if I palpate the C-spine? Still under neck.
No JVD and no tracheal shift.
Okay. Moving down to the chest. If I palpate the chest, do I feel anything?
No injuries noted.
Okay. And if I auscultate again, under chest, does it say anything about auscultating?
No injuries noted.
Okay. Abdomen, pelvis. If I palpate the abdomen, is there anything?
Abdomen soft and no tender and non-tender in all 4 quadrants.
Okay. What about pelvis?
Stable.
Okay. And what about genitalia?
No injury.
Okay. So moving down to the lower extremities, is there PMS present?
PMS present in all 4 extremities.
Okay. Are there any secondary injuries to the legs? Does it say a break?
No injuries noted for secondary wounds.
Okay. Upper extremities, there is PMS, it said, in all extremities and no secondary wounds. Going to the
An extreme extremity assessment, the pulse and motor function.
okay. On the back, if I palpate, is there anything?
Posterior.
Posterior.
No injuries noted.
Okay. And then how about the buttocks?
No injuries noted.
Okay. And lower back?
No injuries noted.
Okay. So there's no secondary injuries. I want to keep that arm bandaged up so that there's pressure on it and I'm not breaking away any blood clotting or anything like that. Other than all of that, I would reassess I would go ahead and reassess every 5 minutes. It doesn't hurt. I think that's everything.